How to cure and treat histiocytosis. Histiocytosis. Histiocytosis is a general name for a group of disorders or syndromes that involve an abnormal increase in the number of immune cells that are called histiocytes. There are three major classes of histiocytosis. Langerhans cell histiocytosis, which is also called histiocytosis X. Malignant histiocytosis syndrome, now known as T-cell lymphoma. Non-Langerhans cell histiocytosis, also known as hemophagocytic syndrome. This article focuses only on Langerhans cell histiocytosis, histiocytosis X. Causes. Histiocytosis X has typically been thought of as a cancer-like condition. But more recently, researchers have begun to think it may be an autoimmune disorder. In this type of disorder, a person's immune cells mistakenly attack the body, rather than help the body fight infections. The extra immune cells the body makes may form tumors, which can affect various parts of the body, including the bones, skull, and other areas. Some forms of the disorder are genetic, which means they are inherited. Histiocytosis X is thought to affect roughly 1 in 200,000 people each year. It is most often seen in children ages 1 to 15, with the highest rate among children ages 5 to 10. Pulmonary histiocytosis X is a specific type of histiocytosis X that involves swelling of the small airways and small blood vessels in the lungs. This inflammation leads to lung stiffening and damage. It is most common in 30 to 40-year-old adults, usually cigarette smokers. The cause is unknown. Symptoms. Histiocytosis X often affects the whole body. A disease that affects the whole body is called a systemic disorder. Symptoms can vary between children and adults, but they may have some of the same symptoms. Tumors in weight-bearing bones, such as the legs or spine, may cause the bones to fracture without an obvious reason. Symptoms in children may include abdominal pain, bone pain, possibly delayed puberty, dizziness, ear drainage that continues long-term, eyes that appear to stick out more and more, irritability, failure to thrive, fever, frequent urination, headache, jaundice, limping, mental decline, rash, seborrheic dermatitis of the scalp, seizures, short stature, swollen lymph glands, thirst, vomiting, weight loss. Symptoms in adults may include bone pain, chest pain, cough, fever, general discomfort, uneasiness, or ill feeling, increased amount of urine, rash, shortness of breath, thirst and increased drinking of fluids, weight loss, exams and tests. The tumors produce a punched-out look on a bone X-ray. Specific tests vary depending on the age of the patient. Tests in children may include biopsy of skin to check for Langerhans cells, bone marrow biopsy to check for Langerhans cells, complete blood count, CBC. X-rays of all the bones in the body to find out how many bones are affected. Tests in adults may include bronchoscopy with biopsy, chest X-ray, pulmonary function tests. Histiocytosis X is sometimes linked to cancer. CT scans and biopsy should be done to rule out possible cancer. Treatment. This disorder is treated with corticosteroids, which suppress immune function, including the dangerous cells. Smoking may worsen the response to treatment and should be stopped. Children may be given other medications depending on their outlook, prognosis. Such medications may include cyclophosphamide, etoposide, methotrexate, vinblastine. Radiation therapy or surgery may also be used to treat bone lesions. Other treatments may include antibiotics to fight infections, breathing support, with a breathing machine, hormone replacement therapy, physical therapy, special shampoos for scalp problems, supportive care, also called comfort care, to relieve symptoms.